me what we're looking at, please.
So this is a video of me inserting the implant through this Keller Funnel. The Keller Funnel is an amazing device that's been around for about 7 or 8 years, and it's basically a very fancy pastry bag. So it allows... I was
going to say right now, it looks like a baking tool.
That it does, but it is designed specifically for silicone breast implants, and you can see that that is a textured silicone implant, just like the one I was holding up. And it allows me to insert the implant, number one, through a much smaller incision. So I can keep my scar a lot smaller than if I were using my fingers to do it. Number two, it allows me to do what's called a no-touch technique. So the implant never comes into contact either with my gloves or with the patient's skin. And that's important because we have come to realize that capsular contractures are a result of bacterial contamination of the implant, most likely from rubbing up against the patient's skin in surgery. So even though we paint the patient with betadine and we cleanse the skin, there's still little bacteria that can live in the pores that they didn't get killed by that, and they can contaminate the implant, not in a way that will lead to an infection with fever and redness and pus, but it creates chronic low-level inflammation. And that chronic inflammation is what has been the most popularly accepted theory for capsular contractures, and it's also the same theory for the development of ALCL. So everything that I do in surgery...
ALCL is that cancer.
ALCL is that really rare cancer. So everything I do in surgery is to minimize the chance that my patient is going to get a capsular contracture. And the Keller Funnel, it has become the gold standard. It really has become the standard of care. So one of the things that a patient should ask for, does their surgeon use the Keller Funnel? And
do you use that a lot as opposed to just what we were talking about here, which is the gummy bear?
The funnel is how I introduced the gummy bear implant, and I use that on every single breast augmentation.
But do you prefer the funnel as opposed to not using it at all?
Absolutely. I prefer the funnel.
You do?
Yeah.
Okay. Yeah. And why so? Again, because the bacteria,
decreased
because the
chance of capsular contracture, a shorter scar, less trauma to the implant. When you put the implant in with your fingers, and this is how we all used to do it up until several years ago, you're basically just pushing in with your fingers, and that can actually fracture the silicone gel on the inside of the implant, which doesn't necessarily rupture the implant, but it can lead to weakness over time, which can lead to implant failure.